Hi, good morning, everyone, and thanks for your patience today. I think my previous session just elongated a bit longer than what was expected with the level 7 students. So we're starting a bit late, and I know some of you, if you haven't been able to join, I'll give another minute or so and I'll post the code on the WhatsApp group so that others are able to join. We'll be looking at starting shortly. And today we are looking at covering learning outcome 4, which is to understand the issues in health and social care. So it's an interesting topic. Some of the things that we will go through today, some of you would be aware, at least have read about it, seen it in the news, and we'll be covering this along with the assessment criteria 4.1, 4.2, 4.3, and then one of the merit criteria, which is an extension to understand what are the campaigns which currently Public Health England in particular runs to look at addressing, public health issues. So we will go through this and start off in a minute, if that's okay. I've got a few who have joined. Thank you for joining. And I'm just going to give it another minute and then we'll make a start. Any questions for those who have joined now? Any questions from the previous session? Any queries? Anything that you want to check with me? We can recap and go through while we give our other friends a couple of minutes to join. So any questions from the previous sessions? So in the previous session, just to do a quick recap, we covered basically different areas of specialism within health and social care. And these included, by one of the exercises or websites that I shared with you was the NHS, careers website. And that is where you could see, these specialisms, the 19 different specialisms, and also some of the professions within those specialism areas. So we are obviously aware of certain common specialisms like medicine, nursing, midwifery, health and social care, or psychotherapy, essentially therapist, I would say. And there could be different types of therapists under that particular specialism area. We have people in the administration, practice managers, and a lot of other areas which are covered in terms of allied healthcare professionals. And those were the specialisms that we looked at. And within those specialisms, then we also discussed a range of professions. So when I talk about medicine, obviously it is a specialism, but under medicine, you have dental care, you have medicine, which basically allows you to specialize into different areas of medicine like neurosurgery, cardiology, orthodontist, gynecologist, pediatrics. So these are different forms or different career or profession options under the specialisms. And then the merit option was to look at understanding how these career professions were actually regulated. And then we looked at some of these chartered bodies, which is the General Medical Association, GMC, NMC, which is Nursing and Midwifery Council, the HCPC, Healthcare Professional Council. So and the idea was to understand their role essentially in managing some of these professions and laying down, what are called quality guidelines, policies, and procedures, so that people working within that particular profession and specialism are able to, conform to those guidelines, and then to at the back of it, essentially are able to deliver services which are quality services related to integrated care plan in the NHS, and also looking at person-centered approach, the 6 Cs, of care. And they are important areas which have been, which are in the remit of these regulatory bodies. And they set these guidelines, policies, and principles so that quality care can be essentially given out. And obviously, various legislation acts, policies, and procedures are being are followed while the care is being provided by various professionals under different specialisms and professional areas. Now, looking at, obviously going into, I would say specialism areas, which are in terms of learning outcomes in particular, what I want to look at is primarily talk about learning outcome 4. In learning outcome 4, what we are looking at is covering essentially, the understanding in terms of what are health and social care issues. And then we have 3 assessment criteria that we are going to be looking at covering, 4.12, as I mentioned, a merit criteria. Now, we've got a fair bit of content to cover, so let's look at the presentation slides for this particular learning outcome and then discuss them in a bit more detail. So let me share the presentation slides. So what we are looking at essentially in terms of, going through it is a couple of things which are related to the indicative content. This indicative content covers things like understanding equality and inequality issues or social and economic issues which are related to providing and, giving out health and social care in terms of, the services by the professionals who work within this sector. We'll be looking at public health issues, which include things like vaccination programs, contraception, healthy ET promotions, and these are part of the promotional campaigns which are run by Public Health England. And then we'll also look at what are the current issues which the NHS actually works on in terms of long-term basis, and they would be things that they work on with the World Health Organization and some of the other agencies, which could be national, international, geographic, and there is the idea is to try and understand what are these health and social care issues that we want to get into. Now, in addition to this, what we also want to do is primarily understand before we get into, I would say, the discussion itself, let's identify what are health issues in general. The overarching, discussion that we want to have when we look at this particular learning outcome, which says understand issues in health and social care. So what are these issues? Now, there are a range of issues that we can look at and how they can be classified or categorized. And these issues could be physical health issues, mental health issues. It could be issues which are in general related to public health, wherein in terms of the environment that you're in, or in general, when we look at, the facilities that you look at getting services from, how are these facilities essentially, managed, and are they safe enough to be able to be used for the purposes of providing health and social care. Then we look at pandemics, and in some cases also look at infectious diseases. Infectious diseases can be of very many different types, things like diarrhea, we have cholera, we have HIV, tuberculosis. They are basically classified as infectious diseases. Sometimes you have infections which human body can pick up, even from animals. And that is where you look at the SARS-2 virus, which was COVID-19, and that was a global pandemic. It was not an endemic, which is related to a local area or a geography, but it was a pandemic because it spread across to the entire globe. And most countries, people in many different locations, countries and geographies were affected. Then we have issues related to environmental quality, things like clean air, water, access to clean air, water. So on most of us use today smartphones. And when we look at the weather, on our smartphones, sometimes you would see, I don't know how many of you looked at paying a bit of attention, but the weather also for your city shows the pollution index, which is air pollution index, the precipitation index, and it also tells you the wind speed, the pressure, any area or, things related to humidity, and also, averages in terms of how the temperature would be fluctuating in your city or your location during the course of the day. So when we look at some of these with regards to, environmental, signs of how the basic things like food, water, air, can affect our health, they would be considered under what are called environmental quality or environmental issues. And then there are issues which are related to injury and violence. So act of God, earthquake, or natural disasters, people get injured. You might have an accident and things like that. Those would be areas which would be covered under what is called injury and violence. Then we look at immunization, and in certain cases, in order to avoid contracting diseases, there are certain forms of immunization or vaccination which is done, at the stage, in different stages in your life. This could be during birth stage, it could be during, say a pandemic. And when we look at those kind of things, when we look at that particular schedule, that is where we will see vaccines like MNC or hepatitis, MMR vaccine, pneumococcal vaccine. These are vaccines which are typically given depending on your stage in life or your age as compared to when you're growing up in terms of development. There are different types of these vaccines which are given. And when this happens on a mass scale, you would normally see this is what is called immunization, versus vaccination.
West Ham had the oldest squad.
So that would the difference when we look at various health issues. And in such cases, when you talk about these various health issues, you're going to be looking at they sometimes being classified as health issues because they are affecting not just one individual or a group of individuals, but population or people within a particular geographic area, country, and in some cases even globally. So COVID-19 is an example of such issue wherein mass vaccination was done across different age groups in different countries in order to prevent the spread of the virus. And they would be an example of, I would say, the health issue. Now, in the past, we've had bubonic plague, which was in the 17th century. Again, that was a pandemic because it spread from Europe in particular to other countries, led to a lot of deaths. And obviously, in such cases, when these kind of diseases, when they spread, and this infection on these diseases spread quite quickly globally, then in such cases, what you generally see is that mass vaccination becomes a priority. And that is something wherein the governments at various levels, national and international level, coordinate with certain health agencies like either UNESCO, World Health Organization, and they are classified as endemic or a pandemic because they are spread across a lot of people areas, and they cover a vast majority of population across the globe. Now, that is the main overarching message that we want to understand today when we look at, in terms of understanding the learning outcome, which is what are the issues in health and social care. And specifically, when we go into the detailing of it, we would look at issues which are primarily related to, I would say, a particular geography or a country. So in our case, when we talk about such issues within, say, England, we'll be looking at healthcare issues which will be classified and studied across on the basis of capacity in terms of how many people are affected, what areas are termed as deprived areas, wherein these services, when I say these, I mean health and social care services, mental health care services are not available, and that would deprive the people or the population in that area to be not able to get proper access to facilities. You look at coordination, which typically tends to happen in most cases. You would normally see or would have read about, like during COVID pandemic, the government had formed a committee, and that committee used to meet daily in terms of looking at coordination of how these activities were essentially run, monitored, and implemented across the country. Then in some cases, you look at areas like staffing, funding, and obviously prior knowledge and best practices, which can be brought into, obviously curb the pandemic in the case of COVID-19, and that is where we had the lockdowns and obviously restrictions in terms of places of work, the 2-meter distancing rule, the face mask, and the 2-meter rule, which was introduced as a public message by PHE or as a messaging to the members of public by Public Health England to ensure that the pandemic or the disease COVID-19 does not spread. Now, in order to understand, how the government works, in a particular country to essentially help, I would say, people get access to, health and social care facilities. I've got a video which is up on the NHS website, and this particular video basically helps understand what could be the, initiatives which the government and in particular the health department takes within a particular country, specifically like England, NHS in particular in England, And this video basically shows that how it is trying to work, to remove inequalities in general, which exist or can, occur in places within our country in terms of impacting the, healthcare or the access to healthcare by different members of the public. So let's listen into this particular video.
NHS England has a mandate commitment to ensure everyone has easier and more convenient access to GP services, including appointments at evenings and weekends. Based on local evidence, services are required to address issues of inequalities in patients' experience of accessing general practice. NHS England has endorsed a patient pathway approach to addressing inequalities, which has been developed by the University of East Anglia. The pathway is part of a new resource that will help commissioners and providers consider how inequalities might arise when people are accessing general practice services. Step 1. Difficulties in recognising health problems. Those who are, for example, socially isolated or with poor health literacy may struggle to recognise health problems. Advertising services and health campaigns can help patients recognise possible symptoms of ill health and when to seek help. Step 2. Deciding whether to seek help or not. Some may be unsure if they should see someone about their problem or may not want to be a bother. Others may be unsure about their entitlements or be unduly worried about the impact of their residential status. People with negative experiences may feel hesitant about seeking help. Services like pharmacists, care navigators, NHS 111, NHS Choices, GP practice websites, apps, and other online services can provide help and advice. Step 3. Actively seeking help. Not knowing where to find the right care can be a barrier. A lack of internet access, not being registered with a GP, or confusion about how the NHS works can cause difficulties. For example, some older people may be less confident using technology, and vulnerable groups such as the homeless may not understand their rights on registration with a GP. Others, such as people who are LGBT+, may fear prejudice or discrimination. Active signposting can help people get the right care in the right place at the right time. Care navigators may help patients who find negotiating the system difficult. Step 4. Obtaining an appointment. Obtaining an appointment at a convenient time can be difficult for some who are worried about getting time off work or from caring responsibilities. Access to appointments at a range of times, locations, and different times can help, such as appointments at evenings and weekends in centrally located hubs. Improved training for receptionists will help to support patients in accessing the right type of appointment first time. Step 5. Getting to the appointment. Those who rely on public transport may find access more difficult, especially those in rural areas, on low incomes, or with mobility issues. Working with transport services may help. Technology and newer types of appointments such as video consultations, online consultations, and phone consultations mean that traveling to appointments is not always necessary. Step 6. Seeing or speaking to someone in the general practice service. Communication between health professionals and some groups may be difficult because of disability, language, or cultural differences. For example, visually impaired patients, autistic people, or those who have learning disabilities may need longer appointments or wish to attend at a time of day when the waiting area is quieter. Cultural competency training and access to interpreters will help. Undertaking a health inequality and equality impact assessment will help commissioners and providers consider equality issues in improving access to general practice services. For more information on reducing inequalities and improving access to general practice services, visit the links provided.
As you can see, obviously, this video kind of shares, I would say, in a much more detail in terms of what are the health and social care inequalities which can be present in the system and how the NHS essentially works in England to counter some of these inequalities, which could be social, cultural, and could impede the availability of services, to the members of public. So this particular video, along with an article which I'll show you, if you read that particular article, which is on one of the slides towards the end, would actually allow you to understand what are health inequalities in general. So it's very difficult to comprehend in a developed country like ours. You could have any sort of health equalities, but that is the fact that when we have people from different cultures, in different areas from where they come from in terms of their upbringing, some of them, especially because of their differences in terms of religion, age, sex, and also their cultural differences, would have access to, in some cases might not have full access, or I would say inhibited access to health and social care facilities within, their local communities. And in such cases, when we do find that any sort of factor like cultural factors, religion, language, or for example, lack of information, if you're in remote areas, things like lack of technology, access to the internet, they can create health inequalities. And that basically, what is the effect of that inequality? That it restricts the access that you can get, to, let's say, get access to health care facilities, which would be required, in some cases can be critical for life saving, and in some cases, important because you need ongoing care from a set of professionals or people, and they would be, causing these inequalities. One of the simplest examples that I would give, if we do away with the jargon and the mumbo jumbo, is that, if I need to get access to a GP, and the video started with that, one of the main things is today, if I call the surgery, I'm not able to get an appointment the same day, or I'm not able to see the GP, for a week or so. And that can create an inequality because your requirement to be able to see the GP essentially is important. And because you're not able to go in and see your GP urgently, which you need to do so, that can create an inequality in terms of availability of service. That means you have an issue with regards to the access to the GP in your local area, and that could be because of the surgery taking on too many patients, wherein the ratio GP per patient tends to be higher than what is recommended by CQC and in the NHS Act, and that restricts you getting access to your GP when you do need that urgent care or consultation in order to, maybe get better, or get rid of, say, for example, a particular condition. So things like access to transport, your facilities in the local area, like access to a pharmacy or a surgery, access to childcare. One of the big issues for working parents can create an inequality, because that would mean parents, if they've had kids and they are kids and their children are younger than the age of, say, for example, 4, they need full-time care. Parents in those cases are not able to work, and that can create inequality because you have no childcare facilities in your area where you're living, and that could impede you from working or earning an income from a perspective of not being able to afford private childcare, or the childcare from the local authority not being available in your area. So these are various examples that I can think of, which as a parent, say, for example, I've gone through, and I've seen some of my friends and colleagues going through, and that would all fall under what is called, healthcare inequalities. So anything that you feel when we define the term inequality, which means if you are getting an unfair treatment, you are avoiding something in terms of an issue which needs immediate resolution, but you're not able to get access to facilities which would basically make the condition that you have worsen. It might worsen the condition. Then in such cases, you would probably term that as what is called inequality. And when we do talk about people who have disabilities or have some sort of illnesses which require long-term care, then in such cases, these inequalities become quite evident and quite clear, because there are conditions that you can be born with, could be genetic. There are conditions that you could inherit in terms of because of your lifestyle or because of your age, and they can impact your health and well-being. And when you do not get access to health and social care services which are promised by the NHS and by NHS England, then in such cases it can lead to the creation of what are called healthcare or health and social care inequalities. Now, one of the main things that we also need to understand is that how do these inequalities or issues that we face. So inequality is basically one of the issues. Now, one of the key messages that we need to understand in this learning outcome is that how does the issue related to inequality and social and economic inequalities, when we further go into detailing of inequality, what do we mean by that? But obviously looking at specific areas like social and economic inequality, then how do we look at addressing those issues when we talk about the NHS in particular, and in England specifically as a country, to address some of these issues. Now, these issues, if I look at without going into the slides, there could be lots of issues that we hear about. One such issue is, for example, there's a funding issue with the NHS, that every year successive governments have to increase budgets for the NHS, because as the aging population increases in the UK, people need more access to health and social care services, even mental health care services. And in such cases, the budget primarily is coming under pressure. So the NHS needs to be properly funded. And that is one of the key objectives of any successive government that we see. And their aim is to try and provide adequate budgeting so that the NHS is able to provide these services to the members of public. Now, when we look at other main issues, staffing is an issue. We do see after Brexit, shortage of doctors and nurses and healthcare workers in the NHS. I think there are, last time I looked at on the website, there are some 55,000 vacancies in the health and social care sector which need to be filled. And in such cases, the government looks at taking on structured recruitment drives, wherein they try and even recruit people. One is training the workforce internally. There are maybe 13 to 14,000 doctors which get trained, every year in England. But in addition to filling that gap, what the government also authorizes is the NHS and the agencies and its partner agencies to also recruit people from abroad. That means outside the UK, from within the EU and outside the EU as well. And that is to relieve the pressure on staffing and resource allocation, primarily because shortages in terms of workforce provides a different kind of a challenge, which means you have a doctor, like I gave an example earlier, if you have a few number of GPs in the surgery and the doctor, when I say GP versus patient ratio increases, then the wait times for you to be able to seek a GP appointment and get to your GP increases. So those could be seen as what are called staff shortages or challenges which people face because they are seeing either too many patients in terms of getting access to the GP, and in some cases too few because there are not enough trained professionals to be able to look into the aspect of providing care. Now, the reason I took up the example of GP is because this is something that we do get to see, and it's a burning issue which gets featured in newspapers, news, and various articles, that getting to a GP or my GP appointment takes months, weeks, and in some cases even months for us to be able to do that. One of the other points that I've also mentioned very briefly is the aging population and the increased demand for care. So as a country, as a developed country, we do see that we are having the aging population is a problem, which is the same issue in certain other developed countries like Japan, Italy, if you look at. And in such areas, when you have people with, people, and you are in the adult,
I can't hear you.
Sorry. You might need to increase the volume at your end. Are others able to hear me? So in some cases, when we look at dipping into the previous learning outcome that we studied, wherein we looked at the different ages and stages of life, and when we talk about later adulthood, in such cases, what you would need is the care, which could be a different form of care that needs to be provided to people who are in their later adulthood, and in such cases, different types of illnesses like dementia, Alzheimer's disease, and some of the chronic problems like diabetes or heart problems can mandate continuous attention and care which is required. And in such cases, again, it puts pressures, different kind of pressures on the NHS and its staff members to be able to provide that care to the aging population or population within a particular geography. Now, we also look at, in 2016, as you know, that the budget for mental health care services was separated from, the health and social care services. Obviously, there are now conditions which are recognized under the mental health conditions, and they require specialist form of care. And in some cases, it requires what is called long-term care, because people are diagnosed with conditions which require long-term care. Now, in such cases, one part of it is to look at a campaign that we will speak and discuss about in the last criteria, is that there are specific campaigns which Public Health England runs in order to raise the awareness amongst people and population about mental health illnesses in particular, because a lot of people are not even aware that this is considered to be an illness, or this is affecting them and their lifestyle in terms of doing their day-to-day functions. So one is to remove the stigma in terms of understanding and building an understanding amongst the members of public, for mental health care services, but also to understand that people are able to diagnose if they have these conditions in time, which can allow treatment and, treatment plans to be set up. And they can make a big effect in terms of people, being able to fight or, get better from some of these illnesses. We have also discussed in the previous learning outcome, which was to look at the integrated care plan, or ICP, as that has been introduced within the NHS. And this planning in terms of providing care to the individual also sometimes looks at taking help of family and friends. So it is not a plan which is just put into place because the patient has been diagnosed with a particular disease or an illness, but in such cases, the healthcare professionals work with the patient and the family and friends and members of the patient to be able to design a plan which actually makes it worthwhile for the patient to, one, it works for them. Second, it makes it worthwhile for them to implement that plan, because they would obviously see different people contributing towards the patient getting better by getting these coordinated services in order to, resolve some of the issues in terms of whether it's a short-term treatment or a long-term treatment plan, but it helps the patient successfully transition between, from having an illness or being ill to one which is where they get better and obviously, get back on their feet and are able to do their day-to-day functions. Now, one of the clear things that I'll give you an example of is that there have been successive governments which have addressed the issue of broadband. For example, broadband and the coverage in terms of mobile telephony, slightly different example than health and social care. There are different areas in the country, or there are remote islands like Shetlands. And, when we talk about Scotland in particular, there are areas in Scotland where the coverage is not good. And that access to coverage has now been, a part of the government plan to introduce a gigabit, internet access to 96% of the population in the UK. Now, because of telemedicine and because of technology playing a very important role, essentially, to be able to get access to some of these services, like repeat prescriptions, as an example, or seeing your GP if you live in a remote area or in a rural area, then in such cases, access to technology becomes an issue. And if there is no access to internet or speed in, broadband, then in such cases, remote services become difficult. And obviously, if I look at areas like Argyll or Furness in Scotland, and they are about 17 to 18 miles away, from the nearest big town where you have a GP surgery, then in such cases, access to health and social care in rural areas becomes an issue. So in order to resolve and obviously sort this out in terms of an issue. Sometimes ambulances, for example, or medical professionals or healthcare professionals have to travel, and the time taken to travel to in such distances, specifically in rural areas, can inhibit care. If the person doesn't reach on time, can lead to a fatality as well. And in such cases, access to technology becomes an inequality issue. So the government is committed in such cases to be able to ensure that broadband services, gigabit internet is available to 96% of the population in the UK, which allows remote services, sometimes health and social care services, which can be provided remotely, like a GP appointment or repeat prescriptions. They can be effectively dealt with, and they can also be treated as, say, an inequality issue or an issue because of non-availability of faster internet. Now, one of the key concepts that we will look at that you need to have also an understanding of is what is called the social determinants of inequality. Now, this particular model in general is called SDH, social determinants of health. Now, this particular model, is quite important, specifically for people who would look at doing nursing, but obviously people who work within health and social care. The government and the World Health Organization in particular has identified certain non-medical factors that can influence health outcomes. That is the exact definition and wording of social determinants of health. And there have been numerous research studies which have been carried out, by the World Health Organization or WHO, and they, after research, have actually, created this concept called SDH, social determinants of health. Now, these are factors which are termed as non-medical factors that can influence health outcomes. So, for example, a simple example that I would give is that if I'm growing up in a rural area or a community which is considered being in a rural area, then in such cases, access to healthcare facilities sometimes could be restricted, and it could lead to poorer health outcomes. For example, in countries which are developing countries, for example, access to basic needs like food, water, and clean air, if they are not available, then it can lead to development of infectious or diseases in general. It can impede the growth and development of a child. And then proper nutrition or malnutrition can also lead to, lifespans being affected. So this is an example of a non-medical factor, which is things like where you grow up, where you are growing up, what kind of an environment you are growing up in, what are the health and healthcare facilities available in your area, what is the education access or access to education that you get within your local area, and what are the economic, let's say, facilities or the economic prosperity in that area, which would essentially also have let's say, have an effect on the outcome of the health that you have, or the, let's say, the opportunities that you have from a point of view of, people having access to, say, good education or good higher education. There is presence of medical colleges or engineering colleges, and you have enough spaces that every child can get. Then in such cases, if you have or get good education in the early years of your life, then that can help you make better decisions. You are able to economically afford, say, better nutrition and food and facilities, and they would give you access to, say, better healthcare facilities in certain countries, because I would say, healthcare is not free in all countries. So welfare estates have healthcare included in some countries, even like the US. You have to have insurance premiums that you pay every month or on an annual basis to be able to get access to, health care facilities. It is not provided by the state, and that is a big chunk of everyone's basic salary that goes towards on a monthly basis to pay for that healthcare insurance or premium. So these things that we do talk about in terms of social determinants of health are factors which are termed as what are called non-medical factors, identified by the World Health Organization, which can have an outcome on how you get access to health facilities and how, in general, I would put it this way, that these non-medical factors actually shape up, conditions that you would have in the later years of your life from a point of view of influence. Now, if you are growing up in an area wherein the infrastructure is poor, there is no access to education or health and social care facilities, then this might give you put you into an unfair advantage, and will create what are called avoidable differences in healthcare. So even when we look at areas within the Northwest, you look at Burnley, for example, there are certain areas in the Northwest which are considered as areas which are deprived areas by the government. And when we look at regeneration schemes, when we look at new initiatives, the last government, for example, introduced a 20 million fund, to redevelop some of the, infrastructure, public infrastructure in the cities, is to basically help build more schools, provide medical facilities, making sure housing and basic amenity related facilities are available. People do not depend on food banks, for example, to fulfill their needs. And in some cases, employment and working opportunities are created specifically by governments so that people are able to earn a livelihood, and that would allow them to have what is called income protection. And in such cases, they would be having the ability to be able to afford better facilities when it comes to food, when it comes to housing, when it comes to, say, for example, employment, education. And these factors in general would be termed as social determinants of health, and that is under the model which is called the HTS model. And that was something which was initially proposed by the World Health Organization. And what I would do is I will put this as a bit of some additional reading that you can do on this, because this is an important concept. And what I would suggest is reading a page or two on the World Health Organization website would give you a very good understanding of what I've discussed and why this turns out to be an important. These 5 factors turn out to be important non-medical factors, which can also have which let me rephrase this. These non-medical factors which can also have an effect on how inequalities are addressed, and in some cases it leads to inequalities that you get, and they can have an impact on the health and social care services that you receive in your particular area. So these are the bits that we need to generally understand, in terms of the overarching message when we look at understanding issues in health and social care. And understanding these issues can happen at 3 levels. It can happen at the policy level, which is what the Department of Health and the government and the bureaucrats do. Then this can also be from a point of view of building an understanding on how these inequalities and issues can be related to impeding people getting access to basic health and social care services in a particular country. And then last but not the least, also trying to understand what are the non-medical factors that can also influence what are called health outcomes. And these conditions which are going to be, or these factors essentially which are going to be non-medical factors, can also influence health outcomes, because sometimes when we do see people are born with certain disorders, or if they do not get proper facilities during the early years of their development, then it can affect the opportunities that they get in terms of education, working and employment opportunities, and also in some cases access to better healthcare in some countries, because healthcare is in private hands and the government does not only subsidizes healthcare facilities. And in such cases, the government looks at, for example, in countries in Africa, in the Far East, European, Asian countries, you look at that the government works with private players to create economic policies and systems which essentially help in development of effective policies that can help in delivering not just proper healthcare, but also in the creation in terms of long-term planning, look at the creation of health and social care facilities which can benefit the population. So what we need to be able to understand is these issues or factors which can cause these issues from a point of view of developing inequalities within a particular area or in geographically when we talk about populations, and how their outcomes can affect or these issues and factors, how they can affect the health outcomes for a particular population, is what we need to be able to understand in this learning outcome. So is the overarching background and message clear, and any questions on this so far? Any questions on what we've discussed so far? Okay, if that's all understood, that's good. Let's go across and discuss quickly some of the assessment criteria which are related to this learning outcome. Now, one of the things which I put a bit of focus on, and the reason I did that is because it is directly related to the first assessment criteria, which talks about accessing equality of health and social care within England. Now, one of the things which I put in here is a chart, which is basically talking about different types of inequalities. And these type of inequalities can be classified into, 3 different categories. So if we classify these inequalities, they can be classified as non-medical factors, which are basically STH. And that is where you see some of the healthcare issues that can arise. So for example, the place where you live and the, say, for example, access to basic air, water, clean water, clean air, and various other facilities that you get, which affect your living and working conditions, are covered in what are called, STH or social non-medical factors, essentially. And they can be things like access to education, when we talked about access to higher education, or access to working opportunities or economic conditions, better health and social care facilities or systems in that area, and then obviously looking at working conditions or living conditions under which you are able to live. So when I say living conditions, when we talk about in some countries in Africa which are developing, in India in particular, or when you look at the Indian subcontinent, you look at far East Asian countries which are still developing, you look at countries in South America, what you're going to see is that beyond these cities, the major cities, people still have, still do not have a decent house or a place to live. They live in what are called mud-built houses or temporary shelters. And in such cases, when we talk about, these conditions having an effect on health and social care of an individual, they have profound effect. And they create inequalities when I compare an individual coming across from a small town or a village in some of these countries. And when we talk about people having access to advanced medical facilities and hospitals, or access to pharmacies or dispensaries, as we call them in those countries, they would have better access to medication or prescriptions and medical professionals, as compared to somebody who's living in a small town wherein they might have to travel 50 kilometers or 30 miles to be able to even see a doctor. And in such cases, they can have a profound effect or create an inequality, in terms of people having access to the same facility. So in the UK, when I say I'm in Manchester and in a developed area in the town, and when I compare, if I go 20 miles out and I compare people living in Cheshire and they are in a rural area, their access to the nearest pharmacies maybe 15 miles or 20 miles, because they have to travel inwards to a town, that would create an inequality. Because if you need urgent care, if somebody is having labor, for example, a woman, she's expecting to give birth and she's living in a rural area and the nearest pharmacy or the hospital is a couple of miles away, you'd probably term that as what is called an inequality, because there is no, hospital or a trained professional which is available who can immediately come in to help. And in such cases, you would look at, this being an inequality because there is uneven or unfair access to medical and healthcare facilities for people living in the rural areas within the UK. So there are a number of factors that we can look at when we talk about access, equality in terms of access to health and social care services. So one such factor could be a geographical location. And as I gave you an example of, people living in the rural areas, even in the UK, which is a developed country, and the top 6th or 7th economy in the world, but you will still have that inequality if people do not have access to, say, technology or fast internet, then their access to GP surgeries or pharmacies might be restricted. And then in such cases, this factor will be termed as because of geographical location. Then you have socioeconomic status. Now, this is where people coming from lower income backgrounds, because they do not have access to employment and working opportunities in certain areas, would also have limited economic status. And in such cases, we would look at, classifying them as under lower income group, middle income group. And when we look at people with lower income group, they would sometimes not have because they are on benefits or they do not have opportunities to find work in that area. Then in such cases, over a period of time, when these long-term studies are carried out, it shows that they have poor housing facilities, they have food insecurity, they sometimes can have restricted education or higher education. And in such cases, this puts a pressure on them because of the socioeconomic status. And this also creates a disparity in terms of people from such areas having higher rates of chronic diseases, mental health issues, and because they have reduced access to healthcare because of the economic status, that also leads to an inequality. Then there are issues like ethnicity and cultural background. There are certain ethnic minorities in our country, like the Gypsies, for example, which move from one location to the other. They do not sometimes have access to facilities because their lifestyle is such, they follow a nomadic lifestyle. And in such cases, you would see that they face disparities in terms of health outcomes because of the fact that certain types of screening, for example, cancer screening for breast cancer or prostate cancer vaccinations, they do not get proper access to them. And in some cases, their cultural requirements do not mandate, for example, in Islamic countries, sometimes women might not even go in to see the doctor alone without a male being present or a male individual or husband being present. So in some cases, it is because of the ethnicity and the cultural, background, which is their religion or their culture, which inhibits access to such facilities when it is required. And in such cases, you would see that this also creates a bit of inequality. Now, there are mental health issues and stigmas. So when we look at people, and I don't know in terms of how many of you understand the meaning of the word stigma, but when we talk about stigma in terms of the dictionary meaning of the word stigma is that sometimes people associate, certain things or circumstances because of certain, I would say, let's say, beliefs and their values. So they might say, okay, no. I say, for example, in certain cultures, if I put it this way, that they've had a bit of a health issue, they might not even go to the GP because they will say, no, I don't need to go to a GP for this small problem. According to them, they see this as a small problem, but it might be life-threatening. But because they carry that particular, let's say, a degree of faith, which basically puts that into a bit of a disgrace, that would mean that, they are not open to seeing, in terms of certain issues. Like, for example, if they have mental health issues, which could be related to, say, for example, a person suffering from low self-esteem or low confidence, or generally in the Indian subcontinent, if you look at the culture, and I'll give you an example here, that if the person is not able to, become a father, then if they have issues related to importance, then obviously they would not go to a doctor, but they would blame it on the ladies to say, no, you are not able to give me a child, or we are not able to do this, and things like that. Now, those are part of it being cultural, part of being societal issues, because that is how they've grown up over the years and centuries in their culture. But At the same time, they will not go to a doctor to get that treatment done because there's a stigma associated with it that this guy or this particular person, has this condition, and people don't prefer to speak about it openly. Now, in such cases, this would be a condition, or the attitude towards this condition would be termed as what is called stigma. Now, stigma could come from various different sources. It could be society related. It could be, related to the culture or the religion, or even, background of the individual. Now, when we do face these issues, and these issues impede again your access to health and social care services, then they would be classified as mental health issues or issues related, because there is a stigma or there is a reluctance to discuss these issues within the culture or within the family. Now, there are a number of points that I mentioned. One, obviously, is related to digital access and digital divide. Again, this is where you have access to, in developed countries, technology is coming to play a very important role. And when we do talk about things like telemedicine or access to online appointments, repeat prescriptions being ordered online, or when you look at online surgeries, which GPs are able to now conduct using Zoom, Teams meeting, or Skype, or things like that, depending on in which country we are talking about, this is related to people not being digitally savvy. That means they have no education on how to use the internet, or in some cases, these facilities are not available in that particular area because of, say, for example, digital access, or fast speed internet broadband not being available. But then these can also cause a bit of an issue when we have population which has not grown up and had training on IT. So if you look at our children today in schools, they learn CAD and CAM, PC, internet, and computer-related areas are a mandatory area of reading in terms of their subjects. But if I go back 20 years or 25 years, when there was the access to PC and the internet was restricted, it wasn't even present in some schools. In such cases, people or population which has grown up with without access to such basic facilities and has had no training or use of that, can affect them getting access to facilities now, because they are not aware of it, they're not trained on it, and they have never used it in the past. So in such cases, this can also be an issue or an inequality which can create, because they are not internet savvy, or not savvy in terms of usage of PCs and electronic devices. Then there are some issues that I mentioned, things like age-related access issues, physical disability, and then when we do talk about regional disparities and variations in care quality. Now, when we do talk about regional disparities, what I mean by that is access to healthcare facilities in certain regions might be better, in certain regions might not be as good as it should be, or as described in the policy, procedure, and practices by the CQC, or, for example, the NHS Act. So in such cases, they could be restricted because of funding issues, because of staffing issues, because of availability of certain services. So if you look at, sometimes when people need to be operated for cardiac related diseases in the Northwest, within Shaw Hospital, or the University of Manchester Hospital Trust is essentially the one wherein a lot of people come in from areas like Bradford, Blackburn, Greater Manchester, Wigan, and they are all going to come in for treatment to this particular area. Now, this is because of the service availability, because of the fact that there are no specialist hospitals or doctors or technicians or staff available to be able to look at such care. So when you have to travel to get specific facilities or care to, say, different cities, or a different city from where you're living, then in such cases, this can lead to what is called regional disparities, and even to a certain extent in the type of care that you receive, because you might go to your GP surgery, you might go to the hospital that is near you, and you might get that care. But if you're requiring that on a long-term basis, and if you have to get that specialist care and you have to travel, in some cases, for example, for knee replacements during COVID, people had to even go from Manchester area to Cardiff or other locations, which was like 200 miles away. Then in such cases, even though the operation has happened there, but the primary care after the operation has happened, the secondary and the tertiary care would be given in the place where you live. And in such cases, this would create a disparity in terms of care quality that you receive, because the consultant or the surgeon who carried out the operation is in one location, but the secondary and tertiary services that you get essentially are going to be in a different, provided by a different set of people in a different location, and they might not understand, how this was put into place or what the integrated planning, care planning was done in order to put the operative surgery into place, which meant that you had to travel to a different or a distant city to get an operation done. So is that bit clear in terms of the first assessment criteria, looking at access to equality of health and social care services within a particular area or a country? Any questions on this assessment criteria? Okay, let's move on to the second one, which talks about explaining the current public health issues within England in particular, because the assessment criteria talks about chosen country. So we are looking at discussing then this from a context of England in the UK. Now, there are various public health issues that can impact different, when I say different, I mean largest number of population in the UK obviously is in England, 57, 58 million. Now, there are certain diseases which we do feel have now been eradicated globally. Things like polio, tuberculosis, in certain countries, they have been totally eradicated. But in some cases, we do see resurgence of these diseases coming back, and populations need to be vaccinated in order to ensure that they do not contract this disease. So when we look at current public health issues in England, if those of you who are tuned into the television and the news would understand that things like rubella, mumps virus, you look at TB, and even polio, they are showing a bit of research coming back or resurgence essentially in the UK. And as a precaution, NHS England is basically looking at newborn babies being vaccinated, with these vaccines, even though these diseases or conditions have been absent in England and in the United Kingdom since the early 60s. But because we do see global immigration and migration becoming a phenomenon, and we have people coming into the UK from different places, they might carry some of these conditions, and in such cases you would see what is called resurgence, or these infectious diseases which are seen to be eradicated in the UK coming back because of economic immigration issues. Now, one such factor that we look at which can cause a public health issue is, for example, smallpox, for example, has been totally eradicated. Polio, for example, has been totally eradicated in most parts of the globe when we talk about population. But there are certain diseases which are very regional or geographic. Tuberculosis is one of them. Now, this is a disease which obviously the WHO, World Health Organization, and when we look at polio in certain countries, they are doing mass vaccinations to eradicate these diseases across the globe. But when we look at certain other type of diseases which have come into the UK for the first time, say, for example, monkeypox, which came in from the Democratic Republic of Congo, has 200 odd cases. And sometimes you hear that in the UK that, how come this has come into the UK? These are things which can cause public health issues, and these are the issues that we need to discuss in this assessment criteria. To give you a fair example, some of us have heard about old Victorian diseases, things like scabies, syphilis, scurvy, polio. These were diseases which were present in the UK before 1940s or before World War II. And they have been brought under control by a structured process and policies which have been undertaken by the government to eradicate these diseases in the UK. So we don't see them coming back. But there were a few cases of smallpox last year, the monkeypox, which we have heard about, and obviously diseases like tuberculosis can come into the country. So here, as a precautionary measure, depending on if you are from a certain background and you're having children, then the GP or the NHS would still recommend your children being given these vaccinations at the time of birth or in 6 weeks from the time of birth, in order to ensure that they do not develop these as conditions going further. Then we look at, obviously, some of the things which are related to pandemics. which obviously can be global. And we saw COVID as one of the reasons wherein everybody, all ages, people in all age groups were essentially vaccinated in order to ensure that they do not contract this disease. Children were even, parents had the option to opt out of that vaccination drive, specifically for children under the age of 12. But obviously, in some cases, the reason why this vaccine was given was to help develop immunity, because the body can develop immunity at a younger age. And government advice was to look at even children undergoing vaccination in order to develop what is called passive immunity, so that if they were to face this disease, then their body would be able to produce antibodies which would be able to counteract this disease. Because in the younger age groups, the body is able to create immunity antibodies, which are then able to fight the symptoms of some of the disease. The symptoms were less severe for people in the younger age groups, and this was primarily because the vaccination ensured that people are able to develop passive immunity as compared to, when we talk about people in the early adulthood or middle adulthood, which were not able to develop. And that is why vaccinations were important. And when we look at COVID vaccinations happening, they started off with the higher age group of people amongst the age group of 80 and above, then 70 to 80s, then 60s to 70s, then 50s to 60s, then 40s to 50s, then 30s to 40s, and then 20s to 30s, and then children in particular. So when we do talk about the second assessment criteria, we need to identify certain public health issues which we feel are issues during current times as well. And those are the ones that you need to highlight by taking one or two examples, and that will help you address this particular assessment criteria. Is that okay? Any questions on this? Okay, now let's go across to the third assessment criteria, which talks about current issues that we see the government making provision for specifically within England. Now, some of these are factors that we have discussed at the start of the learning outcome. These factors could be, now, what are the current issues for which the governments and the NHS has to provision for? Some things, points like funding issues, shortages in terms of workforce or people. If there are not enough nurses or not enough healthcare workers or not enough doctors or GPs who can provide the access to basic services, which are public, basic access to health and social care services to the members of public. And in such cases, you would typically be looking at factors which the government needs to provision for. And when I say provision for, which means that they need to factor it into the policy decisions in order to relieve pressures, which would impede or not be able to, not the departments allow these services to be provided in a usual or a normal manner. And they would be things like funding issues, financial constraints. It could be, shortages, issues in terms of staff shortages. One of the things that I can relate to, again, we've seen that in the recent news earlier this year, is that strikes and union action by nurses, by junior doctors, which basically meant that strikes which happened on the pretext that the public sector pay had been frozen for the last 3 years, and with the rise of living costs, essentially nurses and junior doctors went on strikes for a successive number of days across certain days in January and February in order to negotiate with the government for a pay rise. And then these successive discussions meant, and the strikes meant, that there were disruptions to the basic services which were required, or people who were on the waiting list or people who were on the list for being operated had to look at waiting further. And in some cases, some of the operations and procedures were cancelled because of non-availability of staff or shortage of staff. And this is a issue which the government has to provision for in order to ensure that there is no disruption in these services being provided to the members of public. And in such cases, we need to think of, I would say, examples like these to discuss this assessment criteria, which is looking at current issues in the provision for health and social care services, which the government has to look at in order to ensure that the services being provided. Things like, if I know that, as an example, my mom's on the waiting list for the last 18 months to have a knee operation done. And obviously these strikes and the union action by junior doctors essentially meant that, her wait or the wait on the waiting list has been prolonged by another 6 months. She should have had the operation by now. Obviously, she hasn't had because of the fact that there are 300,000 people waiting on that list, and they are prior to her. Just as an example, I'm not too sure about the number, but just as an example, and she's still on that list to be able to get that knee replacement. So those are issues that we have to think about, which the government needs to provision for when these kind of circumstances arise. And they mean that the normal delivery of services by people working within this sector, which is the National Health Service, healthcare workers, doctors, nurses, consultants, or any other form of people who are associated with providing these services. It means that because they are not able to function or work because of various types of actions like the strike action, then in such cases, you would generally see disruption of health and social care services happening. And that would be something that we will discuss as a current issue. So strike action is a current issue, pay dispute is a current issue, shortage of manpower is a current issue. I would say funding in certain areas on things like the acute coronary diseases, cancer treatments is an issue because there's not enough funds which the government is able to provide to be able to spend on research facilities and research studies. And that means that creation of new drugs or solutions, possible solutions, which normally happens, say in the case of COVID, the vaccines were developed at a rapid speed of within 2 years, but generally a development of a new vaccine or a drug takes between 5 to 10 years. And some of these, if they are not facilitated by enough funding and enough funding for research, then this can lead to, the creation of the whole creation of the drug or the solution taking more time. And this could be treated as what is called an issue under such, under the provision of health and social care services. So you need to be able to think about certain issues which we can discuss, because it's talking about describing current issues which the government needs to think about when it looks at provisioning the health and social care services. So I've taken a number of examples across different categories, things like workforce shortages, funding in particular, here service issues and capacity issues. That means during COVID, for example, there were not enough beds available to hospitalize or people who were requiring inhalators at that point in time. There were not enough of them available, and the government created makeshift hospitals in Birmingham, London, and Manchester, because if there were more hospitalizations and more people needed the critical care, then in such cases, there was a shortage of beds, and that is a capacity issue that you can also look at during a COVID pandemic. So, and then there are issues which are related to. Go on. Any questions? Sorry. Okay, so in such cases, you can think of different issues and then give examples, and that will help cover this particular assessment criteria. Now, the last one is an extension of understanding what are the healthcare inequalities and how does the government actually address these inequalities. So one such way through which it addresses these inequalities is by running public health campaigns, as we call it. So advertisement, in short, if I talk about, other products and categories, but from a point of view of health and social care, we would address them as what are called public healthcare campaigns. That means messaging that the government sends out through Public Health England, PHE, which is the body which is responsible for educating the public, raising awareness amongst the members of public, or running these campaigns which are meant to raise awareness amongst the members of public of certain conditions, diseases, and also removing stigma or disparities, is done by PHE or Public Health England. So when they run these campaigns, these messaging campaigns or adverts or workshops and training, essentially through different routes, they would be primarily aimed at raising awareness of a particular issue amongst the members of public, looking at sharing areas or ways in which prevention can be done, to do away with the particular condition or a disease. And in some cases, encouraging what is called healthy behaviors amongst the members of public. So, for example, one of the campaigns that I can think about, people, and you must have definitely seen this, is the Change for Life campaign, which basically speaks and provides messaging related to that because of the body metabolism index, BMI, and as we see in the younger generation in the UK being more obese, and the BMI is higher than what is required or expected when they're growing up as young individuals. Here, the government is looking at making a fundamental difference by running this campaign, which is Change for Life. When we look at campaigns like 5 a Day, these are campaigns which are run by PHE to ensure that people are actually looking at developing what is called a healthy lifestyle towards how they consume food. And this can help the NHS save a lot of money. And obviously people can, if they raise awareness about, say, for example, that you need to eat healthy, you need to avoid things like oily foods and excessive meat with proteins, or certain types of foods which can lead to the development of cancer, obesity, and other problems like type 2 diabetes and chronic heart illnesses, then the awareness which is generated by campaigns which are run by PHE under different programs, is seen as addressing a long-term public health issue, or seen as an issue which can develop in the long term with the population in the UK. And there are various campaigns that I've taken an example of, because what I want to do is look at campaigns which are run by the British Heart Foundation. You'll have Macmillan Society, which runs, or the Christie, for example, which runs certain messaging and campaigns in tandem with the PHE as a body, is to essentially help make people aware of how to live a healthy lifestyle, how to avoid certain types of diseases or illnesses that they can face in the future if they are able to make this lifestyle change, or the change in their lifestyle in terms of how they eat, what they do, and if they regularly exercise or give up smoking, for example. There are various campaigns that you can talk about, and what I've done in the slides is listed a few of them. Depending on your interest and the area of understanding, you can pick 1 or 2 of them up and then outline these campaigns to understand how the government, along with its agency called the Public Health England in England, looks at running these campaigns, messaging, awareness, training, and different types of events in order to make the members of public aware and raise the awareness amongst them of a particular condition, which allows them to in the long term reduce the amount which would needed to be spent. Because if people are able to follow the advice, develop that lifestyle, that would mean that they would not face these illnesses in the future, which would mean billions in terms of costs being saved on the NHS front. And that is one of the reasons that they run these campaigns. So you have the Better Health campaign, you have the Every Mind Matter campaigns, which is more about well-being. There's another popular campaign which has been run a couple of years earlier called Stopover, and that is to access or allow and educate people essentially about the negative disadvantages of smoking, and that is to encourage people to quit smoking so that they do not develop conditions like lung cancer or conditions which are associated with acts which the government has created in public buildings and public facilities. You're not allowed to smoke within those buildings. And again, this was introduced in the early 2000s. So if you need to smoke, there are smoking areas which are created, and the government provides therapy and obviously sessions for people who are looking at quitting smoking. So this is a campaign which is Stoptober. Then you have Time to Change, Be Clear on Cancer, Change for Life, obviously the COVID campaign, and you see that people who are at higher risk to contracting COVID or flu, essentially during winter, they get text messaging or some sort of messaging on emails coming in from their surgery to say that if you're over the age of 50 or over the age of 60, then you're eligible to get a free flu vaccine or a free COVID-19 vaccine, so that you're not able to contract this illness. In certain winter months, for example, starting October till I would say February, and there is free vaccination drives which are run, and the government actually promotes them through various sort of messaging, which is done or seen as advertising, commercial messages, leaflets, flyers that you pick up, or posters that you see when you go to a surgery or a pharmacy or a hospital, and they are developed in order to raise awareness amongst how to deal with these illnesses beforehand and prevent them, so that I would say billions of pounds can be saved by the NHS on treatment of such diseases and illnesses. And then there are, campaigns which the PHE runs in terms of drink and aware. So 1 unit is equal to how many units you are allowed to have before you can drive. These are campaigns which are run in order to reduce, for example, road accidents or accidents which injuries essentially, which can be caused by accidents when people drink and drive. And they are examples of, various campaigns. Now, I've created some links here, and I've put some specific campaigns, which I'm pretty sure that all of you would have seen, heard, and read about when we talk about these campaigns, because they have been quite popular and they have been running for a number of weeks, months, and years that I've seen. Change for Life is one of them. So I've put a specific slide, from the older version of the presentation and included it here. There is a national flu immunization campaign, which typically tends to happen within schools for younger children and for people who are in the later adulthood over the age of 60, 65. And then the COVID vaccination, although it's not relevant now that much, but there are still people who are considered more vulnerable and they have underlying other health conditions. And in such cases, GP surgeries, pharmacies, along with Public Health England does run these campaigns to ensure that people over the age of 60 or people with vulnerabilities or other underlying health conditions like diabetes or chronic heart diseases are able to get access to the vaccination in the winter months, specifically to avoid, contracting COVID as a disease. So this is what you need to look at covering specifically when we talk about outlining campaigns to address current public health issues as far as England is concerned. So that brings us to the end of today's session. And as I pointed out, feel free to ask any questions. There are some good articles that I put links of in the plenary slide that I would ask you to go ahead and read, which will allow you to build a bit of detailed understanding of some of the things related to topics of the learning outcome, like healthcare inequalities in particular, and social determinants of health, which is an article that I've also put a link of to the King's Fund. And they are the ones that I would suggest that you need to look at reading, after this session to build a bit more understanding on for the things that we have covered in Learning Outcome 4. So at the end, one further discussion that I want to have, is there any questions or any queries that you have for this session? Any questions that you have or anything that you've not understood, feel free to ask me now. Right, that's great. So if there are no questions, not a problem. You can, if you did think of any in the future, you can send that over to me via email. I will post the copy of the recording in this group, and also this would be uploaded onto Moodle so that you're able to access, the recording of today's session. And then I will see you on Friday to discuss the assignment brief for this particular unit. So till then, thank you so much for joining, and bye for now.